Mertes?
Yep. As you know,
what is that?
that's German, Czechoslovakian. So.
All right, go ahead, Chris. I won't ask any more questions. I like to get to know people.
Okay.
As you can tell.
Yeah. Eric Hovde's campaign last week accused you of some campaign coordination misdealings involving Darren Schmitz. I'm sorry. Can you talk about those allegations a little bit?
It's a complete falsehood. You know, when Eric doesn't go, something goes wrong with Eric, he blames everybody else. The truth of the matter is that everything is factual, and nobody in my campaign is connected with the third party, the third party group that's advertising. Absolutely none. And if you would look at the law, Darren Schmitz did something for this about 4 years ago, and the FEC law says, you know, if anybody has terminated with a certain number of days, I don't know how many, it's not even a year, there's no connection whatsoever. So first off, on his face it's wrong. Second off, Darren is only a consultant to me. The campaign pays him to do consulting for it. Campaign is completely separate. Nobody in my campaign is connected with this third-party group. None whatsoever. I don't even know the third-party group. If you ask me the name, I think it's ALS or SLA. I don't even know. But I couldn't even tell you what the name was. I've never talked to them. Don't even know where they're from, and don't know anything about them. And nobody in my campaign does as well. And Darren allegedly did some work for him 4 years ago by issuing something. But the FEC says that if you haven't done anything with them within the past year, there's no connection.
Okay.
Complete falsehood.
I think it's probably the same political action committee that's supporting you last week started running ads accusing Eric Hovde of taking stimulus money. No. He's refuted that. Can you explain what your stand is and whether or not you've asked the PAC to stop running those ads? And
I have nothing to do with the PAC. Nothing whatsoever. I mean, it's first off, it'd be illegal for me to call them. So I'm so above the law. I never even go close to it. I wouldn't call them. I wouldn't tell them. I wouldn't even know who to call. And so, first off, the company that Eric Hovde is with took stimulus money, and so I think Eric should straighten it out with the group that's running it, and I think Eric should work it out with his own group that took the stimulus money. Absolutely, completely. Once again, another red herring by Eric Hovde.
And of course, he's also said that in 2006, while you were working as a healthcare lobbyist, you were in favor of an individual mandate similar to the one in Obamacare. Can you explain your stand on Obamacare and explain how you plan to change that if elected?
Sure, Chris. Thank you very much for the question. First off, he calls me a lobbyist. That's, once again, I've never been a lobbyist at the state and federal. I've told him that. He is, you know, if anybody's talking about misrepresentation, it's Eric Hovde. I am not a lobbyist, never have been, never intend to be, and never will be a lobbyist, either at the state level or the federal level. Never. You have to file papers. You have to apply to be a lobbyist. I have never done that. You can look at any form. I have never, ever been a lobbyist.
I would imagine there would be some issues with you being a former secretary.
There always is. I stayed, there's a period of time, but I absolutely stayed away from it, so I never lobbied whatsoever. In regards to Obamacare, in 2006, in 2007, I gave 2 speeches, Chris. And at that time, the Heritage organization came out and says, we have got to look at individual mandates. I was talking to a group of doctors and hospital people in 2 speeches, one in Texas and one someplace else. And I said, we have to look at this provided the individual mandate is at the state level. Then in 2008, which is a year after 2007, 2 years after my speech in 2006, I was invited to go to the United States Senate, to the Senate Finance Committee, to testify on a mandate for the country. Donna Shalala took the position that mandates were good. I was the position that it was wrong. So under oath in the Senate Finance Committee on May 6, 2008, I'm swearing that I'm opposed to it. A year after I said an individual mandate should be considered, I said a national mandate is absolutely wrong. And I have been against Obamacare, and Mr. Hovde knows this as well, but once again, Mr. Hovde is behind in the polls, so he is He has absolutely misrepresented my record in advertising in order for some way to try and drag me down. And that's the only way he thinks he's got a chance to win, by dragging me down. It's wrong. I've never been for the mandate at the federal level, and I've never been for Obamacare. Obamacare didn't come into play until December of 2009. And I was absolutely, adamantly opposed, and I've given over 300 speeches around the country, not only in Wisconsin, around the country in opposition to it, Chris.
And how would you change that if you were elected?
First off, I'm the only one. All my opponents want to repeal Obamacare, but I'm the only one that's got a plan. First off, you got to base it on quality. I started the quality initiative for hospitals and nursing homes when I was secretary. You've got to be able to make sure that if you go into the hospital, Chris, and you have a disease or an illness, and if you're there, it becomes more complex, or you get a different disease, such as infection, the hospital should be responsible for that, not the individual. I'm building quality into making sure hospitals and doctors practice the profession at the highest level possible. The second thing, 90% to 92% of healthcare, of $2.6 trillion, goes to take care of you after you get sick. And only about a couple $100 million are used to keep you well in the first place. Do you know of any other kind of situation that spends so little on prevention?
Maybe
I want to change.
Even HMOs
I want
encourage you to
that's right. I want to change that. I use the example: if you have an automobile, you know, about 10 or 15,000 miles, you change the oil and grease it, so you don't wait till the motor burns up. Healthcare, you wait till the motor burns up, and then you build a new motor or put in a new motor. I want the money to be spent up front, changing the direction of it. The third thing, chronic illnesses. 75% of the cost of healthcare, $2.6 trillion, goes for chronic illness. Illnesses and diseases that we have some control over individually. And I want more companies to be educating people. I want more information out there, and I want more individuals to have a stake in their own personal health. Learn how to eat properly. Learn how to exercise. Stop smoking if you can. And things like this, which are going to be able to be used in order to make sure that your healthcare system works. The fourth thing, I want to make sure that there's a transparency so that you have control over your healthcare insurance. And I want to be able to have you download your health insurance across state lines. You can buy paper any place in the world. Get on your computer. Health insurance, you got to be registered in Wisconsin to be able to buy it. I want you to be able to go out there and have health insurance companies compete for your business. And then you personalize. What should be my cost deductible? What should be my provisions in the health insurance? And if I'm a single man, I don't need maternity coverage. Okay? Then the next thing, that's 5. Number 6, I want you to be able to change the liability insurance. If you are ugly going into the hospital, more than likely you're going to come out ugly. And you shouldn't be able to sue the doctor in the hospital because you're not beautiful.
That's right.
And so, because so much money is spent on defensive medicine, because everybody is so afraid looking over their shoulder they're going to get sued. I want to be able to change the litigation system so doctors have some kind of protections. If they do wrong, sure, have an arbitration system like workers' compensation and be able to save it. But so much money is spent on defensive medicine. The next thing, the way we pay doctors, it's all on procedures. So in order for a doctor to get paid, well, they do more procedures.
So
do you know of anything else?
He's going to diagnose whatever he can to get
absolutely, and ask for a CAT scan. Have you pay more for your drugs or whatever the case may be. Have another X-ray. I'm saying that let's holistically look at what is it going to cost for you to go have an appendectomy, and then don't have to have a lung X-ray. And if you do have a lung X-ray, it's got to be included in the total project, okay? And finally, about 1% of the people in America use up about 14% of the cost of healthcare. These are the sickest of the sick. What we call them dual eligibles, people that are really sick, need ventilators and so on and so forth. They need a lot of care. But let's do a better job of offering that care. Have a comprehensive plan for each one of those individuals. You will save billions of dollars. That's my plan. And I'm the only candidate that really understands healthcare And the only candidate's got a plan out there. All the other candidates that are running against me want to repeal it, but nobody has got a plan out there to really make sure healthcare works.
Okay. Last week, Mark Newman was endorsed by Wisconsin Tea Party group. Eric Hovde's been criticizing you for your support of Obamacare. Jeff Fitzgerald has been attacking Representative Baldwin for being too extreme for Wisconsin. Which Republican voters are they courting, and are they the same Republican voters casting ballots as when you were governor, when you promoted a Big Tent Republican Party?
I don't think so. I think that everybody's trying to dissect the electorate, and they're all trying to get the most conservative of the conservatives to support them, and so am I. I want the conservatives to support me. I'm a conservative, but the truth of the matter is, I think what we got to do as a party is we got to build the party, and we got to make sure that we win the election. So just winning the primary is not helpful, because you got to win. You got to win the big dance in August. And I'm the only one that's ever won statewide. None of the other candidates have. And I want individuals to support me and vote for me, because they know that I will solve the problems in Washington. And a lot of people are getting outside endorsements. Mark Newman's got the Tea Party Express. Eric Hovde's got another one. But the truth of the matter is, let's take a look at the endorsements in Wisconsin. Farm Bureau, corn growers, dairy producers, the banks, the automobile dealers, the truck dealers, the chiropractors, the hospitals, the restaurant association, the nursing home association. All of these people in the state support me.
It's pretty wide variety.
Endorse me.
Yeah.
And so I'd much rather have people in the state endorsing me than people from Washington and New York endorsing. If they want to endorse the outside, I think I look at it as people from outside are trying to pick the person that they want to be the U.S. Senator. I want to be the U.S. Senator for Wisconsin, not for some group in Washington, D.C. or New York.
You've already talked about this a little bit, but you've issued statements that Eric Hovde favored high-speed rail. They were ending use value assessment for farmland.
I didn't say anything about high-speed rail.
You didn't? Oh, okay. Well, somebody else did. And then that he gave money to Jim Doyle.
Yeah.
Who is the real conservative in this race, and why?
There's only. Well, I think they're all conservative, but I think I'm the real conservative, because I can win. Number one, I can win. Number two, I'm the only one of the candidates that's laid out a program that says we're going to have an 18% ceiling on revenue and expenditures. Nobody else, Democrat or Republican in the country, has ever advocated that.
Wow.
Right now it's 24%. I'm advocating 18%. Number three, I want a balanced budget and have everybody take a 5% reduction, just like I did at the state level. And it worked, and state government never ran better. Fourth, I want to repatriate $1 trillion offshore. Right now, I'm on a board that has several hundreds of millions of dollars offshore that they would like to bring it home and invest in this country. And the truth of the matter is, they have to pay a 35% penalty. These companies have already paid in-country taxes. Okay? Now to bring it, there's about $3 trillion. Just think of
a lot of money.
Just think of it, there's $3 trillion over there. And the federal government is never going to get this 35% penalty, because no company is bringing it back to pay it after they paid the legitimate taxes in the country they're with.
Yeah.
Why would they want to come back and pay another 35%? I'm saying the government's not going to get the money, so let's waive that or repeal it, and you would see $1 trillion. It would be the largest stimulus ever in our country. The Obama stimulus was $867 or $870 billion. But that was from the government, and it was a boondoggle. $1 trillion run by companies, knowing that they have to invest in people, plants, and equipment that they run, would be the biggest stimulus. Can you imagine the economic growth it would be?
I can't imagine.
And it's just setting them, but all you have to do, common sense, get it home and invest it.
So how would you do that? How would you
just repeal the 35%? Companies will bring it back themselves, provided not free of charge. They have to invest in people, employment, factories, and equipment.
Well, they'd do it. I'm sure they would.
They would love to modernize their plants. Know that money's over there.
Yep.
Because they're either going to invest it. They'll either invest in the United States Well, they'll invest it in the country they're in. They're not going to bring it home and pay lose 35%.
In your 1996 book, Power to the People, you wrote, quote, "Like most Americans, my experience with the federal government has not been particularly pleasant. The federal bureaucracy seems impervious to ordinary citizens and governors alike," end quote. When you were governor, you were able to hire the brightest minds and sell proposals to the people of Wisconsin. Being a senator requires working with other senators with bigger egos, and perhaps even being fortunate enough to advance legislation of your own. How will you do this in a highly partisan Washington, D.C., one's probably more even partisan than when you left as HHS secretary?
Look, Chris, the problem with America right now is nobody's solving the problems. I'll give you one example. The doctor fix, which is coming due in January of this coming year. And I'm sure none of my opponents even know this. It's a $350 billion cost. And if somebody doesn't do something before January, all doctors treating Medicare patients in Wisconsin and across this country are going to get a 30% reduction in their fees.
Wow.
You know, any doctor is going to treat Medicare patients with a 30%. It's automatic.
Yeah.
And that's because Congress has failed since 1998 to address the law. They just keep postponing year to year. But now it's going to cost $350 billion, and there's not enough money to postpone it anymore. So now it's coming. Doctors are going to get hit with it unless Democrats and Republicans come together and find a solution to this problem. And what I'm saying is that there are about 10 governors, Democrats, independents, and Republicans, and mayors that know in the United States Senate that know how to make government work. They've done it. And they want to solve the problems. I want to go to Washington to solve the problem. I don't need the job. I don't need anything more on my resume. I've done everything from anybody from Elroy's ever expected to do, okay? And I'm going to solve the problems. And I'm going to form a coalition to get these problems solved. Paul Ryan said it best. He said, if you are a Republican and you get elected, you have a moral responsibility to solve the problems. And I absolutely concur with that. And I'm not going there to delay programs, I'm there to solve programs. And I'm there to form the organizations and form the allegiance and get this job done once and for all.
Why should Wisconsin Republican voters cast a ballot for you instead of the other candidates in this race?
Number one, I can win. Simple as that. I've shown I'm the only one that's ever won statewide, and I've done it 5 times. No Republican's ever done it. Number two, and I'm the only Republican's ever won 71 out of 72 counties. I even carried Dane County.
Wow.
I've carried Milwaukee County twice as a Republican.
Wow, that's unheard of.
Unheard of. I'm the only one that can do that. Number three, I'm the only one. Everybody says repeal Obamacare or Affordable Care, but I'm the only one that's got a plan, as I laid out already, to solve it. Healthcare is going to be huge, a huge problem. And the people in the United States Senate says, Tommy, we can't wait till you get here because of your knowledge base, your experience. You're going to be immediately in the room helping us write it. Number four, I'm the only one that's got the experience at the state level, running a state government 14 years, and running a federal department the size of the Department of Health and Human Services. And number five, I'm the individual that has ideas on balancing the budget, bringing the repatriation of dollars back, becoming energy independent, and solving health care. No other candidate has got that expertise or experience I do. Plus, I'm the only one that definitely can beat Tammy Baldwin.
You want to talk about Representative Baldwin at all? What? I'm sure you could read me chapter and verse on why she's wrong for the state.
Well, first off, let's just take one particular issue. I want a market-based system on healthcare, which I've laid out. Congresswoman Baldwin wants a complete government control bill. She does not believe Obamacare went far enough. She wants a Medicare program for all America. That's her position. On that issue alone, the people of the state of Wisconsin should vote for me.
Thanks for doing the interview. Anything else you want to add?
I just would like to say thank you to the Star for your endorsement, and thank you very much for interviewing me, and thank you for giving me the opportunity to talk. All I can tell the people out there through this media of exchange is that I can win, and I'll be good for the state of Wisconsin. I've done it for Wisconsin. You can trust me, and I know what I'm going to do when I get to Washington to solve the problems of America.
Thanks.